Thank you very much, Ayako. So before I start, I have a few things to say. So firstly, I want to thank the Pranee and Ayako for inviting me to this workshop. As I said to some people early on, that I love coming to Japan, and I come every year, mainly just for conferences so that I can see Japan. So it is a very nice time to come to Japan at this time of the year as well. So right now, what I like to do, well, the whole day you're going to hear from me, and most of the thing I will say, except the first one, a little bit theoretical, but I'm sure that it won't be too boring for you. So don't go to sleep. I try to get something to stimulate you, like watching some video or something like that. And I do have some examples that you can have a look. But certainly in the second part, it's quite theoretical, but it's something that we all need to know when we do qualitative research. It's about theories. So all the research that we do, we should situate ourselves within some sort of theory, and certainly PAR is one of those things. So I just want to warn you that don't get to sleep. If you feel sleepy, stand up, okay? So we try to make it a little bit more interesting. Toward the end of this, I do have something to announce, and it might excite some of you, but let's go through this first. So I'm going to start off with an introduction of PAR. What does it mean? Why do we do this? And what sort of thing that will lead us to if we actually do this research. So a little bit the background, and then we get into some of the important things. Now, when we talk about PAR, I use PAR just a short term of Participatory Action Research. Okay, so PAR. It is what I would call an emergence of new paradigm within the qualitative inquiry, because most often people talk about qualitative research like talking to people, okay? Listening to people's stories, and then you try to make sense of their stories. So you hear often things like that. Things like in-depth interview, focus group, or narrative research, life history. You hear a lot about those sort of things. Of course, you have to hear people's stories. And PAR also has that. You have to hear people's story. But rather than just hearing people's story, you go further. You need to do something in order to improve the life of those people that you learn from. That means your research participant or our research participant. So in a way, it is a new paradigm. And because of that, then it's actually challenged what we call the way that positivist science think about things. That means that, we hear a story, we do something about it, and, that leads to empowerment, lead to the change of life, and so on. So when we do PAR, it makes people who promote positivist science or quantitative research sort of like look at us and say, what you're talking about? What are you doing? That's not pure research, that sort of thing. That raises that sort of questions. So PAR will ask important questions about the construction of the use of our knowledge that we get from the research, and also the importance of power relation between us as a researcher and our research participant. So in the research process, it's actually raised that issue. Now, who has the power? Whose voice that we need to hear? What are we going to do? That sort of thing. So it raised that sort of questions. So it's quite different from other qualitative research. And also it challenged the role of us as a researcher when we engage with a community or individuals that we work with, or local people, if you do international research. And also the capacity of the partners, the two partners, that means we as a researcher and our participant, to do this, okay? To make society a just and more equitable society. So can you see that when we talk about PAR, it's quite different from other quality research, in particular, like quantitative research or just purely other type of qualitative research. We try to get to this. Okay, that means that, put it simply, what we can do when we do PAR, what can we do in order to make people more socially inclusive, to be part of the society, and certainly to improve their life. So quickly, just that's what we mean PAR. Okay, now if you want to interrupt anything or ask questions, just please do. Okay, now when we talk about PAR, this chap, Paulo Freire, is our what we call that the prominent person that we follow his philosophy. In his book that it might come up later on, he wrote a book that we all know is called Pedagogy of the Oppressed, and he talks a lot about this sort of thing. What we do, how we do things, that sort of thing. The main aim or the main goal is this: to lead to a more just society. And how can we do that? It has to go through the transformative social change. So that's his philosophy. But Paulo Freire, his work actually was in education, but then we adopt into health and social sciences and other things because the philosophy is there, and we can just adopt that in any piece of PAR research. So he said that from his perspective, within the PAR approach, okay, our research is not just only a process of getting some sort of knowledge, that means learning about our participant, but it is a process of education, development of consciousness, and of mobilization for action. So in a way, PAR then is the action-oriented research that actually allows or permits ordinary people, that means us, or poor people, or anyone like that, to be able to address our common concerns that happen in our everyday lives. Think about poor people, okay? Now, we know that poor people, are disadvantaged in everywhere. Poor people may not have enough education to think about how to change their life. So Paulo actually did that, okay? What can we do in order to help those poor, uneducated, illiterate people to be able to do something to change their life? So that came from his book, Pedagogy of the Oppressed, and that's what we do in PAR. Now, in the process of something like this, they were thinking about what happened, why it happened to us, why are we so poor, why can't we improve our life, then what can we do? Okay, what can we do in order to do that? In that process, it also generates the people's knowledge. And remember one sort of like, you might have heard this, one of the theories, who talk about the power is knowledge. Knowledge is power, something like that. Once we have knowledge, we also have power to change our life. So that what the Paulos actually or Freire think about in his philosophy, and that's what we do in PAR. Okay, now what else I have to say here? All right, the essence of this, of PAR research is this. When we do research, it will begin with the problems that people face. Okay, so not from us as a researcher that we think that these people need health education, but do they need health education? That sort of thing. So we need to work from them. What do they need? What are the problems in their local communities? What are the things that actually disadvantage them? That sort of thing. So we start with the problem that people face. Maybe not enough food, for example, or no clean water within the community, for example. And then we get those people to participate or to take part in our research as fully as possible. Now, this bit here, I just like you to remember that, the original PAR idea is that what we think, that people will take part as fully as possible. But in reality, it may not happen. So that's part of the challenge. And I will talk about that later on and also in the afternoon. And you probably will hear from Alicia and the group tomorrow as well. Okay, but that is the original idea, that we need to get people to take part as fully as possible. Okay, and our research participants will take part fully or become a full partner in our research process. So they are involved normally from the beginning until the end. That means that from setting the problems, designing the research, the project, collecting the data, writing up, and then disseminate the finding, and also to write up later on. Okay, so ideally that's what's going to happen, and therefore our participant will be treated as, see this, co-researchers. So they're no longer we, the researcher, them, the research. We don't treat people in par that way, but they are our co-researchers. So that means that when we write up our research papers, their names will be in there as well. That ideally that's what's going to happen. But we treat them as our co-researcher, not our research participant or the subjects of our research. We never treat people that way, in par. So together with us as researchers, I use the word us because most of us are researchers here, then our participants become involved in the research cycle, and when they're involved in that, then we can find some solutions for their problems. And that's what I mean by it will lead to empowerment, it will lead to emancipation, and things like that can improve their life in the future. Okay, so that again part of the background about the PAR research. Okay, now I'm talking about the philosophy and thing that Paulo Freire, has developed, and then we just adopt that into our research. The other thing that we have seen is this: PAR is also a social practice. So some of these things in the next few slides might repeat a little bit what Freire, has proposed in a way, but we talk about now as a social practice. And this practice will help marginalized people, and that when I talk about marginalized people here, it can include so many people, like poor people, sex workers, homeless people, who else? I mean, the people who have mental health problem and so on. Okay, they are marginalized because we don't really know about them, we don't really hear about their voices, and so on. Okay, so we're not going to touch that because that is another story there. But just imagine when I talk about marginalized people or vulnerable people, will include those who lack voices in health research policy and services. So imagine them. You probably will have a few people in your ideas now, and this afternoon, the last session, that's what you're going to work, okay? Think about some marginalized group and then prepare some PAR research with them. So, all right, back to this again. PAR is a social process that can help marginalized people to have this. To obtain a degree of emancipation as autonomous and responsible members of society. So that means that PAR, when we do PAR with marginalized people, they will become more socially inclusive members of the society. That means that we will understand their issue. We will learn more about their problems, and then what can we do in order to help them or to improve the healthcare services or life and so on. So that part of the social practice here. So when we talk about PAR, is equal this, okay? Research by the people, research of the people, by the people, and for the people. So see that? It's about the participant. It's not about us or the thing that we want to test or our hypothesis and so on. No, it's about the people, the research participant, the local people that we want to work with or learn from. So that PAR is about. So the ultimate goal is this: to bring about change by improving the material circumstances of affected people. That means people who are affected by, say, poverty or HIV and so on. Okay, so bring about changes. make things for the better for those people who are affected by so many issues in the world nowadays. We do this methodological approach or PAR, the way that we do this, okay? The aim is to work collaboratively, work together with people who have traditional been oppressed and exploited. So these are the people that we never know about them. They never be able to talk or tell us the story. And you can now start imagine who are those people. There's so many in the world nowadays, and I think it will be more and more and more in the future. Okay, so they are people that, as I said, we don't really know about them. Okay, so work together collectively, then some fundamental social change can be achieved through the process of PAR. So some of the things that I said here, I repeat some of the philosophies set out by Freire. So what we do is that we do in order to change the life of our participants, and most often to the better. Okay, so that would be the focus or the emphasis of the PAR. Now, if we look at the word PAR itself, participatory action. So in a way, this PAR actually come from two words, action, okay, AR, and also participatory research, PR. Again, when we talk about just participatory research, the philosophy is grounded in the power of emancipation. And this emancipation, that means, people who know what are the problems and what can be done in order to improve their life. So they have more, the ways that they can improve their life, that sort of thing. Actually, what this sort of philosophy comes from is from the Southern tradition of research. Quite often we talk about two traditions. One is the Northern, and the other one is the Southern part. The Northern part would be the research done, probably more of the normal other people, and quite often, people talk about quantitative research, but also qualitative research. But when we talk about Southern tradition, mainly we refer to people who are poor, people who are marginalized, people who don't traditionally have the opportunity to express their concerns. So there's a few definitions about that, but I won't touch on that. So, but it comes from Paulo Freire that I talked about that before, that he worked with poor people in Brazil. Okay, now the original work would be associated with oppressed people in less developing society. So that's what I meant before, that we talk about poor people, and those people are being oppressed, and that means that that it's not like we oppress them in a way, but they are actually they don't have voices. They don't have ways that they can influence policies and so on, and like that. They are ignored by the majority of the society and so on. So we talk about oppressed people in that sense. Okay. All right. So what the aim of PAR, or the participatory research, is this? Is structural transformation. That means we have to transform the structure of the society, and it targets groups like exploited or oppressed group. And here I just put in a few examples, like ethnic minority groups, indigenous people in some countries, and others groups. So I gave you a few examples, like sex workers, people who are mentally ill, the poor people, and so on. Okay, so we call them exploited or oppressed group because of what I said earlier on. They don't really have voices in policy making and health and social care services. We actually don't know anything about them, and because of that, then we can't actually implement health and social care that can actually help to improve their life. So that would be the PAR part, okay? So the action would be more of the cycle, the thing that happened. Okay, so we just move on. Then the PAR involves individuals, groups and communities who are vulnerable and oppressed. So here we go, I repeat myself again. So PAR involve people who are classified as vulnerable and oppressed. And we argue that great care, really care, is essential to ensure that these people, vulnerable participants, will benefit from our research. And importantly, not to be further exploited or marginalized. Okay? So what it means here is this, that when we do PAR, the participant or people that we work with, okay, who are directly involved in the research should benefit somewhere from our research. So that is the essence of PAR. When we do PAR research, people who take part in our research must receive some benefits or must be improved in many ways. So I think I did say a few things now, like health services, social care services, and so on. What we do is that it's going to improve something or offer them something that can change the life to the better. So PAR commit to this, producing political nature of the knowledge, and also emphasize a premium on self-emancipation. That means that people need to know what are the problems and then what can be done to overcome the problem so that their life can be better. So that's what it says here. Okay, that emancipate people. So we know what can we do. And so when we talk about this thing, we can see that it's actually suitable for so many work, and particularly the culturally, cultural research or cross-cultural research, and also the very, very good for marginalized people in cross-cultural setting. So we have seen that they quite often, when people use PAR, they will adopt in cross-cultural research, and certainly with indigenous people, you see a lot like that. So when we talk about the theory in the second part, you see a little bit more example, and some of the example in this first lecture lot also. You see that, and the video that I'm going to show you, you also see that. Okay, so that's what we see a lot, but it doesn't mean that just only in cross-cultural setting. Just only in Japan, or just only in the UK, or just only in Australia, we do use PAR as well, because that's what we do in order to improve the lives of people. People participate actively, and then it leads to some changes to the better of their life. All right, so that probably continue a little bit more about this philosophy here. Now, one of the things that we have seen a lot in PAR research is this term, CBPR. So it's actually community-based participatory research. So we add the word CB in front of the PR, and you probably can guess when we talk about this, it's more like a target at the we work with people in the community rather than individual. So we see a lot of this, so I like to touch on this bit, because the video that I'm going to show you actually is more like a community-based participatory action research. So CBPR actually sit neatly within the framework of PAR. So that's what I'm going to do, spend a few slides on CBPR, okay? And then we watch the video. Now, what is this CBPR here? So it's very similar to PAR in itself. It's an emerging research approach which equally involves the community, okay, like community members, agency, representative, organization, and the researcher in all phases of the research process. So that, if you remember the philosophy of PAR that I said before, that the researcher, the participant will actively involve in the process. So here is more or less the same thing, but we emphasize more a little bit about community. And also it will empower different groups okay, to collaborate, to take part in research, so that we can appreciate, address the complexity, the problem, the difficulty, political, structural factor, and so on that impacts on their life, in their everyday life. So the same as the philosophy of power. Through CBPR, the relevance, interpretation, and use of research data can be enhanced, and then appropriate dissemination of research findings can be ensured. So CBPR, you can see that when we talk about dissemination, it involves community. And you probably will see something like a theater performance, you can see like dance, you can see like storytelling, and so on like that as part of the dissemination research within the community. And things like that can help people, can raise awareness of people in the community. And that will follow the philosophy of power that, emancipation may happen, empowerment may happen, and people can change to the better. So that's CBPR. Okay, now what does CBPR ensure? There's a few things here. So we just quickly go through this. It actually ensured the bridges and also created trust that build between the community and us as a researcher. So we build some trust with the community. It ensures that when we involve community that way. Research is authentic to community experience. So things that happen within the community, like lack of clean water, that sort of thing, okay? That particular community, like you can imagine in Africa somewhere, there's no clean water, so what do we do? Okay, so it's authentic to the problem that they face. And research questions that we set, we all have research questions when we do our research, but they have to be relevant to the community. Like lack of water, what do we do? That sort of thing, okay? So it has to be relevant to the local community. Research design and methods are culturally and educationally appropriate. So when we use the method to collect the data, which we will talk about this afternoon after lunch, it has to be relevant to the local community. Normally, we probably use, some sort of qualitative methods like in-depth interviews, that's common. Okay? Focus group, bring a group of people or a few groups of people together. But what happens if people can't talk? I don't mean that they can't talk in that sense, but they find it difficult to express. What you're going to do? Methods that will be culturally and sensitively appropriate for the participant, which we will talk about this afternoon, okay? So we need to think about that, okay? Don't just go in and say, I'm going to do the survey. I'm going to do the in-depth interview. Nah, you have to think about local people. Knowledge is incorporated into action based on communities' experiences. So, knowledge here, that means research findings, okay? What can we do with that? Then, the lack of clean water example, what do we do in order to have more clean water, that sort of thing. So, it comes from them and how we can solve the problem together, that sort of thing, and then that's what we have to do. So action, okay? Knowledge leads to action. And of course, then the knowledge from our research will have to translate into some sort of policy. What can we do? Because not just only once that can happen. What can be continued? What can go on after we as a researcher leaves the community? So it has to get to that. Infrastructure is built in order to promote successfully implementation and longer term sustainability when appropriate. Normally, some of these might not be able to achieve, but appropriately we should get to that point. That's similar to what I said here. What happens when we leave the setting? Because as a researcher, we're not going to be there forever. Yeah? We do our research, we do something, that lead to some action, but then we have to go, we have to leave. So what happens with people who are left behind? That's what we have to think about it. But as I said, quite often we might not get to that point because of some challenges that I'm going to touch on at the end of this lecture. So CBPR will ensure things like that. So you can say a little bit different from the philosophy of PAR. It's more, like a more action in a way, more action oriented in a way. Okay, there are many people who adopt CBPR and read in their research. But I just used the example from Judith Bartlett and colleagues who did the work with indigenous people in Canada. Okay, now this bit here, in blue here, in purple here, that was from their writing about their project, and they said this: in contrast to other research approaches that have an assumption that the researchers are the experts, community-based PAR research treats local people as experts who bring forward indigenous knowledge and help researchers by viewing the research through a decolonizing lens. Okay, so they said in their research there. So, we are actually not an expert at all. Okay, but our indigenous people or here, their participant, we have to think about, their knowledge. That means they bring forward their indigenous knowledge, and try to see the research process or help us in a way, to see research through these things. The decolonizing lens I will touch on in the second lecture on decolonizing methodology or theories. But here, because they work with indigenous people, you will hear this word a fair bit. Okay. Now this approach, this research by Judith Bartlett actually provide enormous benefit to local people. Okay, so these are the things that they did in their research. A team-based collaborative approach to research. Team-based, that means researchers, participants, local people, indigenous people. Mutual respect and equitable participation by all involved. So that means that their participants actually participate in the research project as fully as possible. That means equitable, that means between the researcher and the others, and also mutual respect. That means we don't treat our research participants as, like people who don't know anything, people who don't have any knowledge. We professor, we know everything, that's something. No, okay? You can't treat people when you use PAR in that sense. And I would say that for any research, we never be an expert. We just the facilitator of doing the research. Our participants are the expert. Even just survey or in-depth interview, that sort of thing, they are the expert. We learn from them. So never think that we are better than our research participant. Share ownerships of the research and its outcome. So that means that the knowledge that we get, we write the papers together, we the outcome, that whatever that something we share together with our participant. Reciprocal capacity building and empowerment among those involved, and ultimately safeguarding of indigenous knowledge and social change, that the whole thing. And transformation at personal, community, and practice, that means policy, the making and service providing level. So that means that we share, reciprocal, also give back, that sort of thing. Okay, that anything that happened from that particular research. So just one example from Judith Bartlett's research they published in 2007, give you some ideas about what happens when we do a CBPR research, or project. So you can see that it's quite different from the ordinary qualitative research. A lot of things. It's about participant. It's about respect. It's about learning from each other, and also what can we do after the research project. So just some example there. All right, now that's a time for you to actually watch one video. Now here, this one is about community-based participatory research in Nicaragua. Okay, and is a group that called Amos Health and Hope. And it's only about 10 minutes, so it's a good time to break from me, okay? So we're going to do this and escape. Okay, and turn it. Okay, all right, thank you ค่ะ Okay, now we can see from this video here that, you know, there's a few things that I just said in the, you know, like a half an hour, something like that is in there. And when we talk about empowerment, this video also show you that it's not just only our research participants, but those who participate in the project, you know, like they learn how to do research, they learn how to become a health promoter, for example, in that one. It's quite good in that sense. And one of the things that the narrator said is that you go into the community with love. Remember that bit, okay? With love. That means you love the people. That's why you want to go in there in order to help them. Because this love, the word L-O-V-E, I'm going to bring it back in one of the theory later on. So remember that. And I really like the words of Lao Tzu that who said that, you know, go into them, live with them, you know, go in with your love and then, you know, do work with people. I think that's really a very good way of introducing PAR or CBPR. Okay, now we continue then. I just touch on one or two slides on PAR and cross-cultural research, which I did say early on that when we talk about PAR, it actually is a very good methodology or research that we work with indigenous people and also in cross-cultural research. Okay, because why it is really important? Because when we talk about indigenous people and in cross-cultural research, and here I'm talking about when we go into like Nicaragua or we go to to the Indonesia in Aceh, for example, or Thailand, you know, Laos, that sort of thing, we see that there are people who are extremely oppressed by the social structure. And also some of the political and economic forces. We see that because there are so many poor people living in those communities. So PAR would be the best thing that we can use when we want to understand those people. And you know, like when we talk about PAR and its philosophy, you see that nowadays we hear some of these things. You might have heard that or you might not. It's called Kaupapa Maori research methodology. And that's what we have seen now. This Kaupapa Maori research is originated in New Zealand. By Linda Smith, Linda Smith, and she actually is a Maori, and she developed this Kaupapa Maori research methodology, which I'm going to bring back in the second slides here. And that's exactly the same as the philosophy of PAR. That means that it allows people or local people, that means the research, and us as a researcher to be able to work together so that we can set strategy for the priority, policy, and practices of research for, by, and with Maori. Remember that PAR is about research of, by, and for those people. And because when we do this sort of thing, emancipation, of course, will happen. And through emancipation, Kaupapa Maori research then will help oppressed people or silence and marginalized people like the Maori to have more control of their own lives and their community. So Kaupapa Maori research is situated neatly within the PAR philosophy that I have been talking about. I will bring this Kaupapa Maori back later on. Okay, so we start to see some emergence of some research that work with oppressed people nowadays. Now, when we talk about PAR in cross-cultural research, it involves a lot of innovative methods. And now this thing I will talk about after lunch, but here just give you some example here. So we use a lot of non-traditional research approaches. We don't talk about in-depth interview now, we don't talk about focus group now, but you can see this example that I have here. These are the things that we use in cross-cultural research or under the decolonizing methodology or Kaupapa Maori research. Things like arts, photography, theater, storytelling, music, dance, and other expressive media. These are the things that important when we talk about doing PAR within the cross-cultural research, and certainly more, for difficult to articulate the issues. That, as I said, the people can't speak about things, but they can express it through photographs, through drawing, for example, or performance, and so on. Okay. And we also use community meetings and different type of community events, things like theater, puppet, song, drawing, that sort of thing, as a way for us to gathering data. And that more for among illiterate people. That means people who cannot write in a way or cannot express things properly. So we see that we use different ways that we can collect the data. And these what so-called unconventional methods that we use in PAR are actually important in cross-cultural research because it actually offers local people or those marginalized people to be able to express their voices so that we can use the voices in policy making and in influencing health services. Now, why is important for us to do this? Because, most, as I said before, oppressed people don't have the opportunity to express their needs and concerns. So how do we do that? We just do a few things that I have here. And these slides here, I will bring it back. We need to hear the voices of oppressed people in order to break a culture of silence that normally happens with oppressed people. That what it means here that they have never had the chance to say anything about it. And here you don't need to think about indigenous people or poor people, even among educated people, but they never have an opportunity to talk about their issues. We have seen that too. Like I'll give you an example. Lots of women, lose their children, and some people have lost through miscarriage, through neonatal deaths, or later on because of the suicide of their children and so on. Have you ever asked them to talk about things that they have been through, the thing that traumatized them? You might think that losing a child is not an easy, it's just, someone just passed away, particularly when we talk about miscarriage like that. But to the woman, to the mothers, a loss of a child is the main thing in their life. Have we ever talked about that? Have we ever asked them to talk about that? And that's what I mean by, that can be part of this, what I call oppressive people, that they never, they have to stay in silence, they have to live in silence. So we think about that, yeah? Okay, so not just only poor people. I want to tell you that it's not just only about poor people, illiterate people, but, for some groups, they have never had the chance to talk about their issues. So CBPR and PAR would be the best thing that we can do. But it's not an easy thing to do, so we will talk about that later on. Okay, now I did give you the example of Judith Bartlett with the indigenous people that happened in 2000. They wrote about it in 2007. Now I want to give you a very, very recent example here that happened in Liberia, and it's about Ebola. Okay, so a few slides here. It's very interesting thing that what they did with the CBPR or PAR. Okay, Jones and colleagues, they use PAR to work with local people to build maternal health services in post-Ebola Liberia. So I think most of us would know that the Ebola happened in Africa, and here just in Liberia. So during the Ebola crisis around March 2014 to January 2016, Redemption Hospital was a holding facility for suspected case of Ebola. And also 12 hospital staff during that time lost their lives to Ebola. So hospital staff died because of Ebola. And because of that, then it created violent hostility from the community. yeah, about why people die from that. And that happened at this point, the New Crew town in the capital city of Monrovia. Okay, so that's just one area that they do. So because of this hostility, then inpatient services, including maternity care, was closed down for 6 months. And imagine, in poor area, when maternity care was closed down, what happened to the mothers, okay, that with baby or pregnant women, that sort of thing. All right, anyway, when the hospital was reopened in early 2015, yeah, not many people used the service. Okay, certainly about the bursting services, and imagine that too, what happened when women don't use that. And the main issue was what? Was the community did not have trust in health workers because 12 of them died from Ebola. All right, so that was the problem, yeah? Okay, and so because of the lack of communication and trust between community member and the formal health system, okay, therefore people think that research has to be done, and PAR would be the potential or best way that they can do the research in order to see what happened and to bring the mothers back to the hospital. So what their PAR methodologies seeks to do, they seek to generate process that challenge dynamic of power between individual and groups, as well as to cultivate relationship between stakeholders and service provider. That means the community and the service provider. So it was started in 2015, so that communication between the healthcare worker and the community can happen. And so their PAR involve pregnant women, community-based trained traditional midwives, and traditional birth attendants, community leaders, and health workers. So you can see that it involves a few groups of people who would be prominent or who would be the main actor of maternity services in the local area. So that's what they decide, that it will include these people. All right, so that's what they plan. Okay, and now the PAR project involves 2 stages. Okay, so the first one is like to gather information, see what happened, what can be done, and so on. So they did 2 days meetings, yeah, and which involve different groups of people, and they look at the current experience of services, how the Ebola impact them, and also important issue that needs to be addressed to improve services. So they talk about the issues and what can be done in order to improve that. Then the finding of the meeting was discussed within with their own wider groups, and then the feedback was brought back to stage 2 meeting. And in the stage 1 meetings, a number of tools and activities were utilized, okay, in order to allow people to talk and also to stimulate discussion. And they use a few things like this. Okay, picture codes, pie sorting, social map, Venn diagram, Ebola virus disease, timeline, ranking and sorting, pairwise ranking, and marketplace. So see, none of this about talking in a way. It's about doing a few things, looking, drawing, designing something like that. So that how they get the information that they need. So some of these things I will bring back when we talk about the methods, but not everything. That's just some of the things. So they use a few things like that to collect the data. Right. And then stage 2 meeting involved a 1-day meeting. Now this time include all groups, not just only a few separate groups, but all groups, to identify actions that address the problem and improve experience of services. So everyone come together this time and talk about the problem and what can be done. They established a coordination committee, and the progress markers, okay, for the action plan. So they think about committee and then what would be the plan for the action. Then they identify action, okay, they would be reviewed by particular group and so on. All right, so I just go quickly like that. Just give you some ideas about what they do. Their findings, okay, suggested this, that Ebola worsened community hospital relations and the pre-existing weaknesses in maternal services. Finding also suggests that the PAR process established evidence and improved communication as well as interaction between the community and health worker. So they found that because of the Ebola, the healthcare system was weakened and so on. Okay, so that from the finding they get that quickly. Okay, now then what they can conclude here is that the PAR methodology uncovers significant issues that allow community members and health workers to understand each other's experiences and needs, and created meaningful links and strengthened communication between a hospital and its surrounding community. So the PAR actually allowed things like that to happen. That means we see what was the issue, why people don't come back for the maternity services. And in their conclusion too, Jones and colleagues also suggest that PAR methods can be used effectively in low resource settings, but also in post-crisis contexts where health systems need to be rebuilt in a way that makes them responsive to current needs and resilience to a future crisis. So in crisis situation, PAR for Jones, okay, would be the best thing that we can do in order to understand the issue, in order to bring people back to the, say in their case, the use of maternal health care, that sort of thing. So think about that, we can actually adopt PAR in so many crises. The situation nowadays, it just happen too often. If you watch the news, you can see, we have this in Australia. We are not in summer yet, but we have a big bushfire. That means fire in the forest in Queensland and northern New South Wales, and the fire went on in days and days and destroyed people's houses, animals, lives too. Okay. And that sort of thing, there's crises like that happen too often. And here, over there in Australia, we think, we're not in summer yet. Okay, this is just, what we call is the spring, sorry. I got the seasons wrong. We're just in spring, but we have bushfires. Bushfire means the fires that happen in the forest, that in Australia we call bushfires. Just like that, things like that. And you can see in the world nowadays, so many crises happen, so too depressive, so stop there. All right, so what they say is that we can use PAR, in order to improve the healthcare services. And to me, I think it's the lives of people as well. Okay, now, talking about PAR, I talk about good bits, I talk about what we can do, that so on. There are some challenges. So I bring you through a few things quickly here. There's a few slides there. In the last session, I will talk about when we work with a particular group of people, and tomorrow I'm sure Alicia and the group will show you some of the challenges as well. So as in any research projects, in any research methodology, we also have pros and cons. We do have good bits, and then we have the challenge bits, okay? Things that may not work according to what we have planned, that sort of thing. So I'm going to present you a few things here. Now, remember we talked about the ownership, yeah? In PAR, the ownership of data and knowledge is very important, okay? Not just only us as a researcher who own the knowledge or the data, but our participant as well. Now, what happens, if there's conflicts between the ownership of the ownership between us and between the researcher and the participants? Okay, how do we share that? Okay, these are the things that can be what I call is an important issue, crucial issue. What happens to the data when the researcher need to publish findings as required by our institution? And of course, you know, many of us would know this. You have to do research, you have to publish, because if you don't publish, you're going to perish, that sort of thing quickly. Now, what happens? What happens when we want to publish things and then our participants do not agree with that? That can be one thing. Are we going to include everyone in the papers? Say, for example, in your project you involve, I don't know, I mean, normally we involve some key players, you know, like community leaders or some people who do a lot of work. But what about other people who claim that they have also involved in that? Will you include them? What happens if 20 people on the project, that sort of thing? It can happen, but you know, things like that can be an issue for us too. So the ownership of the data. What happens when the participants say, no, you can't write it up because that belongs to us. We want it to, you know, to be a locally stuff in there, that sort of thing. It can also happen. Okay, so these are the things that you have to discuss with your participant beforehand and negotiate. Okay, so talk openly with your research participant about the final products, what do we do with the knowledge, that sort of thing. So be clear, okay, be open with your participant. So they local people in particular need to be clear about the dissemination, the finding, the ownership from the beginning. So be clear about that because it can be a problem. What about the expectation? Okay, different expectation between researcher and the funding bodies, or also the institution. Okay, the conflict here quite often is about, you know, like the length of time that we do PAR research. We cannot just do it in a very short time. It's no way. You know, no way. Sometimes it takes a year or two or something like that or longer in order to complete the whole process of your PAR project. But then what happened with when your dean said you have to produce that, you know, by March next year or something like that. And okay, so, or even the funding agency. We do have only like maybe 3 years the funding. And by the end of the 3 years, you have to produce a report or something like that, and yet, you know, you haven't finished that. What is going to happen? That sort of thing. All right. Now okay, you know why I said that we can't do that in a short time? Because PAR, as you can see from a few slides and the video, it involves so many people. It involves so many things, and working with people. It's not something that I say it can happen in 1 week or 2 weeks or a year, because things do happen and then you have to be flexible. You may have to wait for a few months or something like that. It's not a quick thing that you can do. Okay, so that I'll talk about that. The last thing, because of the length of the time, sometimes the people will say that I can't see anything, you know, I can't see any progress, and so on. So it can also create some sort of problem. You can't see that, you know, thing had happened. So the time involved in a PAR project can be an issue here. Okay, so that's the second one. Now, what else? For researchers who come from an academic background, okay, we might have a bit of problems, or we might not be able to become involved in a project until the end of the process because of the time and funding constraint. That's what I said early on, that, you know, like what happens because it takes a long time and we can't, we have funding, say, for 3 years, and then then that's it, you know, then what do we do? Because we haven't actually finished the whole thing yet, and we can't get any more money to continue. So what's going to happen? So it can be another issue here. Sometimes it jeopardizes the whole project. Okay, now what we do is that, and what we have seen also in the video, is that we need to involve NGO, non-government organization, and government agency from the beginning. Because when we leave, because of the funding issue and so on, they can actually continue. But then, working with NGO and government agency can create another problem for us as well. So there are lots of challenges like that it can actually jeopardize our project, or it can slow down the project, but most often people find ways that they can solve the issue. So these are some of the things that the thing that happens. So what I want to say here, I think I touched that. Okay, political group, I think probably I don't need to say that too much. Okay, so these are the things that I think that can be a problem, which we have to discuss from the beginning. We have to find some flexible ways or flexibility in order to continue with the project. So what I'm saying here is that it's not an easy thing to do, but once you have done that, you're going to find so happy or rewarded about the project that you have. Okay, now the hierarchy of the work that I did touch on that before, that particular when we work with the oppressed people, we never treat them as people who don't have any significance or any good bit, that sort of thing. We can't treat ourselves as the researcher who stay up here and participant down there. We have to reduce that. And in order to achieve that, we have to have some skills in order to work with people. How you present yourself, how you treat people, and so on. So these are the things that you have to cultivate yourself. That's what in the video say, that you have to go into the community with love, that sort of thing. You have to have the authentic commitment to local people. You have to love them and do things that can actually make your project's success. Okay, so respect, love, reciprocity, and also on that sort of thing, we have to have that in ourselves. And for some people, it can be an issue. So that may be another challenge there. All right, so I think I have said a few things now. So I want to conclude this first lecture here. Now, have a look at what Freire said, published in 1972. To be a good participatory research means, above all, to have faith in people, to believe in the possibility that they can create and change things. So we have to believe in our people, in our research participants. Okay, we actually have to believe in them. So in a way, PAR to me, okay, is the research that is participatory and also unites those who take part. That means us and our research participants. Now, when we talk about our society now, we have seen inequality always everywhere. Is a common phenomenon in all societies, including Japan, Australia, UK, and so on. Okay, it's part of our life in a way. So it's approach that PAR is an approach that can actually help to reduce this inequality by making people more socially included and to be able to hear their voice more and so on. Okay, and through the process of PAR, empowerment, emancipation will happen, and because of that, then it can actually reduce the social exclusion in the community and make people more socially included as well. So, Tandon, who actually has written about this, say this: it's only when the issues of control over health and the political economy of research in health sciences are addressed, both in our practice and in our theories, that we will be able to make health a truly human endeavor and not one that is limited to expert scientists, laboratories, and medicines. And I think what he said here is very, very true indeed, and is actually what we have seen nowadays in our society. So that's what I want to include here. conclude here. Now, these references are the ones that I cite in these slides. So if you want to go further to look at that, you can get a few more things. Okay, so that's it. First, the lectures. Any questions? Any comments you want to make?